Welcome to a session on the Central Services, Medical Attendance, Rules, 1944. These rules establish the framework for providing medical attendance and treatment to central government employees and their dependents, ensuring they have access to quality healthcare services. It outlines eligibility, medical coverage, approved hospitals, and reimbursement guidelines. The CSMA rules cover all permanent central government employees, their eligible family members, and, in some cases, pensioners. Employees of autonomous or statutory bodies where these rules have been adopted. Applies across different ministries and departments, including defense personnel. Except those in railway service and certain non-gazetted ranks in Calcutta. Applicable when employees are on duty, leave, foreign service, or suspension. The rules cover spouse, dependent or otherwise. Children, up to the age of 25 years if unemployed and dependent. Dependent parents residing with the employee. Dependent siblings subject to age and income criteria. Pensioners and family pensioners are entitled to medical benefits. Family pensioners, spouse, children, continue receiving benefits after the employee's death. These individuals can access medical facilities through a network of approved hospitals and designated medical attendants under these rules. Medical facilities available under the CSMA include outpatient department, OPD, services, which offer routine checkups, consultations, provision of medicines, diagnostic tests, and minor treatments at government clinics or hospitals. For more advanced medical needs, patients may be referred to specialists for further care. For inpatient needs, hospital admissions under the CSMA cover surgeries, critical care, and treatments. Employees are entitled to free hospital accommodation in government hospitals or subsidized care in approved private hospitals. Specialized treatment is available for complex cases. Government employees requiring specialized care may be referred to centers like AIIMS or other empaneled hospitals for advanced treatments. CSMA rules also cover maternity and child care, offering complete prenatal and postnatal care, childbirth assistance, including surgical procedures if necessary, and essential vaccinations and immunizations for children to support the health of government employees' families. An authorized medical attendant, or AMA, is a qualified government-appointed doctor or private practitioner authorized by the government to provide medical care to employees. The AMA's responsibilities include providing primary health care, diagnosing illnesses, prescribing treatments, referring patients for advanced care when necessary, and certifying medical bills for reimbursement. Employees are required to select an AMA from the designated list for their locality or department. Approved hospitals and healthcare centers under CSMA include central government hospitals such as AIIMS, Safdarjung, and regional government hospitals. Coverage extends to military and state-maintained hospitals, as well as any government-approved facility for treatment. Private hospitals and nursing homes approved by the government are included under CSMA for specialized treatments. These private facilities are empaneled through the Central Government Health Scheme, or CGHS, which provides comprehensive healthcare access to employees and pensioners in major cities. Beneficiaries receive CGHS cards, granting access to these services. The referral system under CSMA ensures access to advanced care. If a patient needs specialized treatment, the authorized medical attendant, or AMA, refers them to an approved higher medical institution. Prior approval from the employee's department may be required for referrals to private hospitals. In emergencies, employees may seek treatment from any nearby hospital, whether public or private, without prior approval. Emergency treatment may include surgeries, ICU care, and urgent medical interventions. Employees must notify their department within 24 hours of hospitalization and submit documentation for reimbursement later. Post-treatment reporting is necessary after receiving care at a higher institution. The AMA certifies the treatment, and the employee submits the documentation to their department for record-keeping and reimbursement processing, ensuring accountability and continuity of care. Eligible expenses for reimbursement under CSMA include costs for medical consultations, diagnostic tests, prescribed medicines, medical devices, surgeries, and room charges for approved room categories in hospitals. Employees submit original bills, an AMA referral certificate, and a claim form for processing. Reimbursements under CSMA are capped based on Central Government Health Scheme (CGHS) rates or equivalent government rates for treatments at private hospitals. Expenses exceeding these limits must be borne by the employee. Pensioners are also eligible for reimbursement but must submit claims through their pension office, accompanied by all required documents. In cases of emergency, government employees and their families may receive immediate care at any nearby hospital, including private hospitals. This provision covers life-threatening situations, surgeries, ICU care, and other urgent interventions. Employees must notify their department within 24 hours, submitting the bills and reports for reimbursement approval. CSMA rules allow employees to claim travel expenses for medical treatment. Employees who need to travel to receive specialized care may be eligible for travel allowances, including provisions for family members in certain cases. These travel benefits ensure access to required healthcare services. To prevent misuse, CSMA rules have established penalties for fraudulent claims or unauthorized use of medical benefits. Any misuse, such as submission of false claims, may result in disciplinary action and potential loss of benefits. In cases where an employee cannot travel for medical treatment, certain healthcare services can be provided at their residence. This includes follow-up consultations, primary care visits, and necessary treatments arranged through authorized providers. The CSMA rules allow for medical treatment abroad in exceptional cases, where the required treatment is unavailable in India. Government approval is required, and employees must provide documentation to support the medical necessity of treatment abroad. Recent developments in the CSMA rules include digital initiatives designed to improve service access and transparency. These initiatives include online referral systems, electronic claim submission, and digital records, simplifying the process for government employees and their families. Significant amendments have been made to the CSMA rules over the years to address new healthcare needs and enhance access to services for government employees. These amendments ensure that the rules remain relevant and effective in supporting employees' healthcare needs. Thank you for learning about the Central Services, Medical Attendance, Rules, 1944. These rules ensure that government employees and their families receive essential medical care, supporting their health and well-being while serving the nation.